Good afternoon, everyone. My name is Catherine Leswing, and I work for the Bureau of Student Wellness at the New Hampshire Department of Education. Thanks for tuning in to today's session of Wellness for All this fall. Today, we're very excited to be joined by Dr. Sarah Vaithilingam, who specializes in child psychiatry at Dartmouth-Hitchcock Medical Center. And she is here to talk to us today about the highs and lows of navigating large cultural traditions like the holidays, which for many of us are coming up this season. But I imagine a lot of the research and best practices apply to any sort of large-scale cultural tradition. So thank you so much for being here with us today. We would like to, just making sure the tech is going. There we go. So yeah, thank you so much for being here with us today, Dr. Vaithilingam. We're really excited to hear what you have to say about cultural traditions like holidays that are here. And I'm really going to just turn it over to you to inform us about what we can expect this holiday season and what's typical, and maybe some best practices for how to beat the holiday blues.
Okay, so I work at Dartmouth-Hitchcock. I'm a child and adolescent psychiatry fellow, and we deal a lot with depression in kids. But what's the point of even discussing this? So we know that unipolar depression is highly prevalent, but it's also very debilitating. And in community services completed in 14 countries, they estimated that the lifetime prevalence of unipolar depression occurs in 12%. And the World Health Organization ranks unipolar major depression as the 11th greatest cause of disability and mortality. And unfortunately, in the pediatric population, depression usually presents with the pediatrician, and it's often undertreated. And in multiple nationally representative surveys and retrospective studies, they show that about 40% of children go untreated. And the success of treatment of depression, and particularly suicide prevention, depends on our ability to identify and influence the factors that considerably increase the risk of suicide in the population. And the risk is primarily affected by social psychological factors, whose effects become highlighted in relation to certain social events like the holidays, Thanksgiving and Christmas. So where did this idea of the holiday blues even come from? And so for the last 50 years, there's been a steady trickle of psychoanalytic articles on the psychopathology associated with the holidays. Even earlier than that, in 1990, Francisi wrote his classic article on the Sunday neurosis. And he discussed symptoms such as headaches and stomach aches that arise on the day of rest, so Sunday. And he argued that the key to understanding the regularity of these nervous symptoms was recognizing the way that in which traditional day of rest offered a kind of liberation from daily pressures. But so for neurotics, so for people who have anxiety and depression, they are used to repressing these impulses during the week. And so on the day of rest, impulses such as self-punishment fantasies mobilized against them and then manifested in a form of headaches and stomach aches. And then in 1941, Eisenbud was more specific, and his studies were based on 2 case reports of 2 women that were in psychoanalysis with him. And he described symptoms particularly associated with Christmas. And the way that he described Christmas is as a time of greatest relaxation on the part of the superego of society. And in these 2 cases, which involved the 2 women, they had recurrent Christmas symptoms related to an intense wish to become a man, and the hope that Santa Claus would magically grant them that wish. And then we have Cattell in 1955, and he coins the term the holiday syndrome. And he defined it as a reaction beginning a few days before Thanksgiving and then lasting through January 1st. So who was James Cattell? He was a Harvard and Columbia trained psychiatrist and psychoanalyst. And he described a fairly specific reaction in a certain group of psychoanalytic patients that he was seeing during the period between Thanksgiving and January 1st. And he characterized the holiday syndrome. And as you can see, I outline the symptoms: diffuse anxiety, helplessness, possessiveness, irritability. But then when you compare it to the symptoms of depression, there are major parallels. So diffuse anxiety, trouble concentrating, helplessness, we see that in the actual definition of depression: feelings of hopelessness or helplessness. Increased irritability or frustration, we see that in the pediatric population who suffer from depression. And then bitter rumination, feelings of worthlessness or guilt. And then Cattell acknowledged that the syndrome was most common among those who had few stable emotional relationships outside of their family, as well as a history of family disruption and separation, leaving these individuals feeling unloved and unwanted. And that's a common trend that we see in the clinics today. So society's role, and this is where Durkheim comes into play. And he said, if one were to try to foretell logically what season should be most favorable to suicide, one might easily assume the season when the sky is the darkest and the temperature is the lowest. And he wrote the book, The Suicide or Suicide. And when we talk about the holiday blues, we're talking about egoistic suicide, the sense of not belonging. And Durkheim was especially concerned about how modern industrial societies can be held together when people don't even know each other, and when their experiences and social positions are so varied. He argued that places with the highest rates of alcoholism and mental illness are not actually the areas with the highest rates of suicide, but in fact, he maintains that suicide rates are the highest in moments when and in places where individuals lack social and moral regulation. Durkheim suggested that the rhythm of temporal fluctuations in suicide can be considered to be parallel to the rhythm of social life. Some individuals are not integrated into society and are not involved or interested in the ceremonies, while other individuals are integrated or overly integrated. And, I would emphasize that it's our duty as neighbors to integrate those individuals who may be left on the periphery of our communities.
I think this is, if I could just jump in, I think like that really hits home for me, and thinking about students this holiday season. And we know that a sense of belonging really has huge impact on outcomes for students. But just thinking about those societal expectations, whether it's around holidays that are traditional to, any given religion or culture, but when there's those external pressures to have that sense of belonging, and what it feels like when we don't have that, and how that could lend itself to increased suicide and depression. So I just think that those research papers and studies are really fascinating and really highlight that. Thank you for sharing those.
Yeah, absolutely. Even especially in the time of COVID, when we see a lot of individuals who can't travel to see their families during the holidays, it's really important that we kind of include them. When we talk about the holiday blues, it's actually become very common for media outlets to report on particular mental health dangers posed by the holidays. So loneliness for some and stress associated with travel and family reunions are routinely cited as contributing to a rise in the episode of depression and a spike in suicides. A study of the Annenberg Public Policy Center in Pennsylvania found that 70% of newspaper stories touching on the theme during the 2013 holidays linked the holidays with an increase in suicide. So it's a lot of articles when we're talking about like Christmas and Thanksgiving. But interestingly, the Christmas season tends to be a time of psychological stress, but not a time of psychological failure to cope. So mental health professionals and organizations have repeatedly disproven this widely accepted assumption And in fact, the months of November, December, and January often have the fewest daily suicides during the year. And then according to the most recent available data from the National Center of Health Statistics, the most daily US suicides usually occur between the months of actually April and August. So how can this be? And there are a few hypotheses. I'm going to discuss two. The first one is the death dip hypothesis. And this was coined by Phillips and Feldman, who proposed the death dip hypothesis. And it suggested that individuals are able to postpone their death in order to witness various positive events, such as the holidays. Their close involvement would cause them to die post-maturely, and the result would be a fall in death rate before important occasions, and depending on the way that the death was kind of postponed, a rise in death after or immediately after the holiday. But this group of researchers, what's interesting about them is they studied famous people and they studied famous people and their birthdays. And so a famous person's birthday is publicly celebrated and they receive lots of gifts and there's a lot of attention given to them. So it didn't really apply to the ordinary person, except the group of researchers found that evidence that the holidays to some extent have a postponing effect on suicide, with particularly significant suppressing effect on suicide at Christmas. So I thought that was interesting. And then there's the broken promise effect. So Gavinish stated that springtime weekends and holidays are usually affectively positive events. And what I mean by that is that we get excited, we're happy, we look forward to it. But they also may promise more than they can actually guarantee or that actually takes place. And according to the theory of a suicidal individual may be influenced by approaching events such as spring weekends or holidays, because such events tend to promote hope or expectation in people that will feel better than they do before these events. However, if individuals for some reason are especially vulnerable to the risk of suicidal behavior, there's a buildup of expectations, right? And then there's the letdown at the end. Frustration, disappointment, that can all trigger a suicide reaction. And then this author described the holidays as kind of a suicide immune system. So leading up to it, there's kind of an immunity because you're so hopeful about what the holidays will bring. But as psychiatrists and modern day psychiatrists, we practice with evidence-based medicine, and that's usually based on statistical research. And statistical studies do not support the idea that Christmas is a public health hazard. No measure of psychopathology in general or depression in particular has ever shown a consistent increase before Christmas. And whether the measure is the number of suicides or the psychiatric hospitalizations, outpatient psychiatric visits, or emergency room visits, there is no significant pattern. So there were two studies done, one by the WHO that examined the effects of suicide rates in the holidays, and they found that before Christmas, there were fewer suicide attempts. And then after Christmas, there was a 39% increase in attempts. And the second article, and this was over a 7-year period, and it was in 1972 to 1979, but it still applies. And they consistently found a decreased emergency visits in the 3 days preceding and on the day of the major holiday, with a complementary increase in visits 3 days immediately after the holiday. And the fluctuations in visits surrounding Christmas have been interpreted as reflecting a unique combination of psychosocial supports and stressors typical of this season. And so leading up, there's a lot of psychosocial support in our communities. We have a lot of events that take place, a lot of community gathering, and after, not so much. So it makes sense. They also found that, and interestingly, they found that patients with the primary diagnosis of substance abuse visited more often during Christmas and the holidays, whereas other primary psychiatric diagnosis visited less often. And so we can say that substance abuse is a form of self-medication, and so maybe the people coming in are more depressed. But you know, the use of alcohol is a reflection of our culture, and plays a huge role in us celebrating Thanksgiving and the holidays. And so we do see an increase in uptake in substance abuse at that time. So what do you do if you are depressed around the holidays? Because I'm trying to tell you that you can't be, but it happens for our community, and it happens for a lot of people. And so medications and psychotherapy can be effective in treating depression. And in fact, that's the standard of care. So in combination, you have the best bet of remission of symptoms. And that's how we mark whether our treatment is successful or not. And the primary care physician can start an antidepressant, and a psychiatrist can start an antidepressant. Both do a really good job at it. And most antidepressants are safe, but there's a caveat. So the FDA requires that all antidepressants carry a black box warning. And so there's a thought that there's a slight increase in suicidal thoughts or behavior when you're taking an antidepressant, especially in the first few weeks. So if you are started on an antidepressant, it's important to be very cognizant of the symptoms that you're experiencing and to be in good communication with whoever your prescriber is. And then when we talk about psychotherapy, we talk about talk therapy and talking about the condition and how depression feels for you. And there are different types of psychotherapy, and it's really, really important that you as a consumer are aware of the different types of therapy. And cognitive behavioral therapy is one, interpersonal therapy is another, dialectical behavioral therapy is another, but the therapy should really suit the symptoms, and you should have a plan and a formulation that is made by your therapist. And psychotherapy can help you identify negative beliefs and behaviors and replace them with healthy and positive ones. They can help you explore relationships and experiences, and they can help you find better ways to cope and solve problems, and that's really, really important. So one of the useful resources that I use in the clinic for my patients is this 211 New Hampshire, and it has a list. It's actually really, really well organized of all the mental health services available in New Hampshire, and it's categorized in a way that either by symptoms or diagnosis, but you can really find specific kind of providers through this website. So if you are symptomatic and you are having issues and you would like to see somebody, I would suggest going through this website. So that's pretty much the end of my presentation. If you guys have any questions, please let me know.
Thank you so much. I learned a lot in that presentation, and I think one of the things that stood out to me the most was that, you know, I think the media over time, and it looks like over the better part of a century, has kind of played up this idea around the holidays being stressful. And again, as we mentioned, you know, it doesn't need to necessarily be these American holidays that we celebrate or Christian holidays, but these big cultural phenomena that we experience as a culture, that there's almost like a hype around it. But it's not really a clinical phenomenon, for lack of a better word. But one thing that stood out to me that you mentioned was that it's not, I forget how you phrased it, but it's not a failure to cope, but there are a lot of feelings around the holidays that can crop up for people. But it seems like in many ways, people do have those coping mechanisms, or some folks do have those coping mechanisms. Do you have any insights about what types of coping mechanisms could be particularly helpful? And especially it seems like on the days following a holiday or an event.
Yeah, absolutely. So we talk a lot about coping mechanisms in therapy, and it really is unique to the individual. But one of the things that I preach with my patients is exercise. And in the winter in New Hampshire, it's very, very difficult. And I can understand that. But nonetheless, if you can get out and go for a walk for 10, 15 minutes, walk the dog, maybe do the steps in your apartment building, that really gets the endorphins going. And it kind of gives you a positive attitude about your body in general. And so I think that's very important as one of the coping mechanisms. You know, people use all sorts of things. Some people draw, some people knit, some people, foster animals. Those are all great coping mechanisms, and healthy coping mechanisms is really just based on the individual and what your interests are. And I suggest that you explore it, because there's a lot of different things that you can do to help calm you. Even those fidget spinners, those are great. When you're anxious in school or in social settings, those are great.
Yeah, and thinking about schools too, and that the role that hope plays in kind of getting people through the lead up to the holiday itself. Do you have any suggestions or thoughts on how educators or families could, not overly promise or overly, still engaging in that positive planning and excitement around it, but we do know that students in a classroom won't have an equal holiday season a lot of times, and that there are students who don't have the same experiences. And I'm just thinking that I'm sure educators are getting more mindful of that over time, but I know when I was a kid, there was a lot of hype built up in the school building itself. So I'm wondering if you have any thoughts on that.
Yeah, during the time of COVID, it's really hard. In the past, I would say, share, go to your neighbors, have the conversation, make those social connections. The social connections are so important. And we see that they play a huge role in psychiatric conditions. Unfortunately, with COVID, it's very difficult, even to the extent where you can't really tell that somebody's smiling at you because you're wearing a mask. And that has a profound impact actually on our mental states. But my thought is to engage as many people as possible. And as a community, I think that's our responsibility, is to reach out to our neighbors and reach out to the families that may not have what we have.
Yeah, I think, that's a great idea. I know there's a lot of different organizations that are working hard to make sure that, families and those who lack housing security and food security have something to get through the holiday season this year. And so I would encourage folks to check that out in their own community. And I think, no matter your economic status, you always have something to share and to give others, even if it's a little time. And I think that piece of the holidays can be a great coping strategy, actually, for children to see, I'm part of something bigger than just myself and my own close-knit family. So
exactly.
Well, this was really phenomenal. I learned a whole lot, and I think
I'm glad.
Because it seems like, just personally from my own experience, there is definitely something that happens around the holidays. I love that cartoon that you shared.
Yeah.
I think it resonates with people, but the idea that it's not actually, a psychiatric risk factor necessarily, but there's ways that we can support each other to get through some of the heightened emotion, heightened expectation, and support our communities. I think you really gave some great ideas. And so we really want to thank you for your time today.
Thank you.